get the right dose at the first time, because a lot of times, after dosage, if you mess up the dose the first time, it's been proven in studies that only 8% of patients receiving those medications feel that medications will help them in the future afterwards with their issues. So
especially in mental health, where
exactly mental health
and
space.
All of those drugs. Dr. Dover, feel free to jump in on this as the pharmacology expert, but so many of the antidepressants, so many of the antipsychotics, so many of them are exquisitely affected by cytochrome P450 mutations. And these are super common in the population. Up to 30% of the patients that are receiving these treatments will have a mutation. It's a pretty high number.
Yeah, it's the human side of things too, right? It's a quality of life issue if it takes longer to get to a drug that works for that patient, right? It's a delay in their care to get to that state that they need. It can impact adherence to any medications in the class, to Jen's point. If they've had an adverse effect with one drug in the class initially that could have been prevented. And I think those are key things, especially when you get into the mental health side of things. They're challenging diseases in general. And so to try and treat them as expediently as possible, it's very important